Good afternoon, colleagues. My name is Siphokazi Dada from the South African Medical Research Council. I am with my colleagues from the University of Cape Town, Fergus, Ashburner, and Shaheema, Allie. The title of our poster is Drug Demand Reduction Through Training, Research, and Intervention, a case study of the University of Cape Town, South Africa. Since its transition to democracy in 1994, South Africa has experienced a dramatic increase in the use of a variety of different substances of abuse, leading to increased rates of unintentional and intentional injuries and other problems. This led to subsequent increase in research activities, and there has been a number of evidence-based studies that have been conducted in the last 10 years. One of the studies reported that South Africa has a high lifetime prevalence of substance use disorders, estimated at 13.3% of the general population. The 2016 South African Demographic and Health Survey reported prevalence rates for alcohol use of 18% for women and 54% for men over the age of 15 years. A smaller proportion of substance users access substance use treatment centers. Treatment rates for substance use disorders have been reported to be low due to a lack of treatment experts in the workforce. Strategies to combat substance use in South Africa. In 2007, the first biannual Anti-Substance Abuse Summit highlighted the importance of strengthening mechanisms to implement strategic initiatives and to ensure positive interventions for vulnerable members of society. In particular, the summit suggested introducing educational programs in higher education institutions to deal with substance use. The provincial government's Department of Social Development therefore invited higher education institutions in the Western Cape to design training initiatives which would be contextually relevant and would address the challenges of substance abuse in the Western Cape. This gave birth to the training programs offered at the universities in the Western Cape. I'm going to hand over to Fergus to tell us more about the program that they offer at the University of Cape Town. Thank you.
The University of Cape Town's postgraduate diploma in addictions care was developed in 2011 and was funded by the Western Cape Provincial Department of Social Development, which provided for operating costs and bursaries for the students. The curriculum was based on the US's Substance Abuse and Mental Health Services Administration's, or SAMHSA's, guidelines regarding core competencies in addictions care and other internationally accredited curricula. The key objectives of the diploma is to enhance knowledge and skills of professionals with evidence-based practices in the addictions care field, and in particular the target audience was doctors, psychiatrists, social workers, psychologists, or anybody else who had an appropriate academic qualification and was working in the addictions care field, or also recognized prior learning students. So students who did not necessarily have an academic qualification but were working in the field. In order for them to apply, they would have recognize prior learning students would have to compile a portfolio of evidence and a rationale for them to be able to complete the course. Challenges that we have experienced since 2011 were regarding the modular structure of the course. Professionals have found it difficult to take leave to attend all the modules and exams of the course, and often have to use annual leave in order to complete all the attendance requirements. Employers also have difficulty having their professionals attending courses 4 times a year over the 2-year period. We also have varying degrees of practical or academic exposure of the students. Recognized prior learning students often struggle to transition into their academic setting, but do have quite a considerable practical skill. So a lot of time has to be spent by our teaching staff to academically coach recognized prior learning students. And then psychology honors or social work students who have freshly graduated have limited practical exposure, and quite a considerable amount of time is spent in individual and group supervision, developing practical basic counseling skills of these students. Finally, students often take the course, which allows them to then develop their studies in different areas. For example, psychology students might then use the course as a means to get into a master's clinical psychology or counseling psychology degree, meaning that the skills that they've developed on the course aren't immediately integrated into substance use services, but take a number of years to be implemented once the master's studies have been completed. And lastly, there are some funding limitations. Due to the high cost of tertiary education in South Africa, very few self-funded students have attended the course over the years. There's also a difficulty in the course is meant to upskill professionals or people working in the addictions field, but does not lead to a formalized qualification or job title with no posts available. Future considerations: what would a postgraduate diploma look like in a post-COVID world? And how do we make modifications for this? Do we have a blended learning platform with an online offering? And how does that look in an African setting with the inequitable access to education and connectivity? Thank you. Shaheema Ali has undertaken to evaluate the postgraduate diploma in addictions care for her master's thesis. The aim was to investigate students' knowledge, attitudes, and explore experiences related to evidence-based practice approaches taught in the postgraduate diploma in addictions care at the University of Cape Town. The objectives of Shaheema's study is to assess attitudes and perceived knowledge gained by the students related to evidence-based practices approaches taught on the postgraduate diploma, to explore experiences of graduates in integrating evidence-based practices taught on the postgraduate program into substance use services as part of the occupation, and finally to elicit graduates' recommendations on how the postgraduate program can be improved for future students. The study design was a mixed methods, quantitative and qualitative research design, and participants would have to undergo 2 phases of the design. The first phase would be quantitative design, where all students registered for the diploma between 2011 and 2018 do a 5-minute online questionnaire. Phase 2 would be a qualitative design, where students who completed phase 1 and who graduated between 2012 and 2018 20 graduates would be selected using purposive sampling to undergo a 45 to 60 minute semi-structured interview. Analysis for the questionnaire or phase 1 would be a statistical package for social services would be used, and descriptive statistics then would be conducted. Continuous data would be analyzed using t-tests, and categorical data would be analyzed using CAR tests. And comparing groups of participants by profession and the year of their first registration. Bivariate logistic regression analyses would also be conducted. Interview 2, the interviews would be transcribed and developed into a code book. The data would be imported into a qualitative software program, and then thematic analysis would be completed. The ethical considerations: all study procedures have complied with the current version of the Declaration of Helsinki's Ethical Principles for Medical Research involving human subjects and the South African Guidelines for Good Clinical Practice. Ethics has also been approved by the UCT institution. Future considerations: a possible update in postgraduate diploma evidence-based practice teachings, a development of the addictions programs throughout the Republic of South Africa, also diversifying possible funding sources for the postgraduate diploma and assisting other African countries in developing their educational offerings for addictions care. Thank you very much.